without doing the sideline position. Sideline is a fantastic position. If I can treat only sideline, I would do. It's good for people with aches and pain that is hard for them to lie on the front or back. Most people are most comfortable in the side lying, they're sleeping on the side. Obese pregnancy, people with lower back pain, neck pain, all would benefit from sideline position. Yeah, lift your head, thank you. Right, so how can we work on the draping? We do the same 2-towel technique, and then what you can do is just come around here and just drape it this way. You always need to be careful when you're putting pressure here, because the tendency of the towel to be moved down. If you want to do it in a different way, you can fold that towel and actually drape the hand, the arms, and then you can be having a lot easier position to work on. Can you lift the pump the table a little bit up? Thank you. A bit more. Okay. Good. Right. First of all, it's quite nice to do some tractioning technique onto that area. You can take the hip as a whole and traction erector spinae and QL. Yeah, petrissage. A lot of the sideline, you can feel that the muscles comes to you. You don't have to lean over. It's quite nice and easy to work on. And then you can do some more compression technique. I'm now on the lateral side of the erector spinae muscle. Work very slow down, and then, mind you, I'm not suspending my hands, but actually holding it onto their sides. When you come to that area, you can actually work with your knuckles on the sacrum. There are a lot of tendons, like fascia, coming from gluteus maximus and medius, latissimus dorsi, abdominal muscles, they're all coming and attaching onto the sacrum. So it's just really nice to work on the sacrum itself. At time, it would be very tender, yeah, and very good to work in here, getting blood circulation to all these tendons. I would like now to work on the QL, quadratus lumbarum. For that, I am starting my journey on the spinous processes. Now I'm on erector spinae, and then I work even further outside, and I feel actually the hip bone. QL is a thin muscle that is deeper than the erector spinae. So I need to come from the side, actually, even sometimes from the front, and palpate. So it's a small place. Do you feel that? Mm-hmm. Now, how do I know that I'm on there? If I go a little bit more forward, I actually has no resistance. Go into the back. And then I can mobilize it a little bit by moving the hip. So in a way, I'm taking the hip up and make the muscles more relaxed. Do you see that? Yeah, the muscle attached, the quadratus lumbarum attached below to the hip bone. So if I move the hip bone, I actually lax that muscle like that. Yeah, lax and then neutral. I lift the hip upward and lax it. I can do the same thing by lowering the ribs, or I can do together. Petrissaging with laxing erector spinae, or you can do the opposite. You can traction and stretch it. So really think about it like a fiber. You lax it, you stretch it, you increase the blood circulation through all these changes. Good. You can do it a little bit more dynamic. Let's change position and create a bit of oscillation into that area. Remember that infraspinatus, what we did to the hand? It's quite similar. You actually introducing to that muscle movement. It's stuck. You want to mobilize it. So a lot of hip movement. And then you can do hip stretch. Again, hip movement. And stretch. And stretch. Good. Once we're here, we have a chance to look at gluteus medius and minimus. Is it tender?
No, it's quite pleasant actually.
Yeah, okay. So you can do petrissage to that area, or petrissage with the base of your wrist. If you have really muscular person, too deep? Is it good enough?
It's okay, it's good. Just for...
Yeah. Even bringing it together and making the muscles lax again.
So with Salan, do you have to turn the person to the other position so you can do it on the other side as well?
Yes, you have to. Yeah. Because now it's quite hard to work from here. I mean, it's possible, but it's a lot harder. So you have to use it wisely. Yeah. Should we